final video in the stretching series, we're going to look at the shoulder and the arms. Often neglected by us dancers. We're all about the hamstrings and the quads, and we don't often pay attention to stretching the upper body. But it's really important if you are doing a lot of upper body work, weight bearing, and particularly if you're doing partnering work and lift work, you need to be stretching out these muscles. We all do. And let's bear in mind, these muscles are not just about dance, right? Daily life, phones, laptops, these guys need some help. Now, we looked at the muscles that go up into the neck, that kind of shared with the shoulder, so the trapezius and levator scapula. So if you want those ones, go and look at the spine stretch video. Here we're going to focus on muscles that operate the shoulder more on the front and the back of the body. We all know that muscles work in pairs, right? So we're looking at some of these paired relationships. We're going to start with the rhomboid muscles. You might not be familiar with these. We'll get you to turn around back view because they're on the back. They're going to run between the shoulder blade, the edge of your shoulder blade. You've got your two little triangle-shaped shoulder blades. Between the shoulder blade and the spine, we have a couple of muscles that run in a diagonal this way between those two spots. And if you just squeeze your shoulder blades together for us, that's their job, right? They pull those shoulders and squeeze them together. So they're the rhomboid muscles. So you can see how they are part of the mechanism that's operating the shoulder. Now, to stretch these, we're going to look at a couple of stretches. You can come and face the front again now. A couple of stretches. The first one is a standard stretch, but for a lot of dancers, they don't feel it, particularly if you've got quite flexible shoulders. But give it a try and see if it works for you. So we're going to bring the arm across the front of the body, that's it, and bring the other arm to use as a counter weight to provide a little overpressure and pulling forwards. Try and keep the shoulders level as you do it. Are you feeling that in those rhomboids we just switched on? No. He's quite flexible in the shoulders. Are you feeling it at the top of the arm at all on that side? So it will sometimes get the deltoid muscle, which is the little, I call it the t-shirt muscle, the little cap of muscle that sits over the shoulder. But for most people, they won't feel that as a rhomboid stretch. So we need to modify it. Okay. This one is a bit of a pretzel stretch. Some people won't be able to do this. It just depends on the level of flexibility around the shoulders. If there's a lot of muscle bulk around the shoulders, it can be difficult. So it may work for you, it may not, but give it a try. But you need to be, it's a bit like patting your head and rubbing your stomach, this one. We're going to cross the arms above the elbow. So make sure you're not crossing at the wrists, above the elbow. Then wrap your hands around so that they meet in a prayer position. And if you just turn sideways for us, we want to make sure that the arm is coming straight out at the shoulder and then we're 90 degrees. If you just bring those hands to your forehead, that's not going to give you the stretch. We need to pull those arms away. Then once, and you're already feeling it there, yeah, oh yeah. And then we're going to take those hands up to the ceiling. How's that? Mm-hmm. Yeah. So that one will hit this spot on most people. Okay, relax down. That's a pretty strong stretch, but at least you're in control of it, so you can take it, remember, just to that sweet spot. Doesn't have to be painful. It shouldn't be painful. Just take it to where it's like, ooh, that feels good, and hold it there. That one you're probably going to only hold for about 15, 20 seconds. It can feel quite tiring, actually, to do. We also need to do that the other way around. It's a little bit asymmetrical. It'll stretch one side of the rhomboids more than the other. Most people often are like, oh, I can't remember which arm I did. Don't think about it and cross your arms. Normally you'll go to your dominant one. That's the one you would have done first. So do the other one. Switch them over, wrap around, and again, 90 degrees, up to the ceiling, and make sure you're not raising your shoulders as you do it because you won't feel the stretch. And interestingly, a lot of people will find it's tighter one side than the other. Are you finding that?
Yes, yeah.
Yeah. This side tighter or the?
This side's tighter.
This side's tighter. Okay. So again, always good to understand where we've got differences between the right and left in our body, and it may be we want to do a few more repetitions on the tight side until they match, particularly with muscles like this that attach into the spine, because they're exerting a force on the spine, and the spine likes the forces to come in equal measure. So if we've got more tension on one side than the other, it can affect the spine as well. So make sure you're factoring that in to your stretches. Okay, the muscle that pairs the rhomboid muscle is and we had a rhomboid major and minor on the back. Go and look at the shoulder anatomy video if you want to see a visual reference for that. On the front of the body, we have the pectoral muscles. We normally call them the pecs, right, as a group. And again, there are two layers. We have an outer pectoral major muscle that starts at the chest bone and comes out and attaches actually to the upper arm. And then underneath that, we've got a deeper one, the pectoralis minor muscle, that actually comes from a little, I've got another spare body part here. This is your shoulder blade from front view rather than back view. And there's a little prominence you can see here that sticks forward, and it comes forwards just in this little space here. And that's where that pectoralis minor muscle is attaching to, and it's coming from there down to your upper ribs. And this is the one that can get pretty tight, particularly if you like to sit with your phones like this. The old rounded shoulder posture will shorten and tighten that muscle. So we need to find good stretches for these. Now, the best way to do these is if you find like a door frame or a pillar that you can hook your hand against. That's the best way to do it. We don't have one here, so I'm going to pretend to be a door frame for you. So we're going to do, if we come round, use this arm, there we go, and then turn yourself sideways to me. So we've got the arm at shoulder height, palm facing forwards to you. I'm being a wall or a door jamb, right? The door frame is good. And then what he's going to do is turn the body away so that the hips go with you. Are you feeling a nice stretch across the chest there? Great, and come back. And let's do that now facing the front so we can see it front view as well. So you're going to turn away, lovely, and I'm being pulled over by the strength here. Now, things that people do wrong with that is they often try and twist, don't take your hips with you. Are you feeling a stretch there? No, I mean, I'm not having to give any resistance at all. You need to turn the whole feet, legs, hips so that your whole pelvis points to the side, and then we're getting that opening there. So that's for the outer muscle, the pectoralis major muscle. To get the little one underneath, and this will also get the biceps, one of the heads of the bicep muscle, we're going to do exactly the same thing but with a bent elbow. So still straight out, 90 degrees. Again, I'm being a door pillar here, and then turn the body away, and we're getting, and that one's always a little sweeter, right? A little, oh. If you do that stretch and you feel any pins and needles, tingling numbness into the arm and hand, stop, okay? Right under that pectoralis minor muscle is a plexus of nerves that come from your neck on their way down to the arm. So the nerves that serve the arm come right through there like in a little funnel. And if you've got tension there, it could be pressing on the nerves. If you're getting that, you really need to go and find a healthcare provider who can help assess that and make sure that you're not doing. So don't push into stretches when you're getting tingling. Remember, that's one of the cautions of stretching. Stop, get some advice on that. But for most people, that'll be a nice juicy stretch for the pec major and pec minor muscles. Also, that shorter one incorporates one of the heads of the bicep muscle, because it's quite a difficult muscle to stretch without being able to bend your elbow backwards. So count that as a bicep stretch too. Another muscle, the pair of the biceps muscle, is the triceps muscle, which runs down, if you just turn this way, perfect, it runs down the back of the arm. So to stretch this one, come back around to the front, we can bring the arm up and over the head, bending the elbow, and then grab a hold of your elbow with your other hand and pull that arm towards you. Getting a stretch there into the tricep, yeah. So just standing there, you might feel it, but you could also then take that into a side bend to sweeten it up. It might increase the stretch here, or it might increase the stretch into the ribs. We're incorporating the ribs here. Remember, it's quite hard just to stretch one thing in the body. So you can take a whole stretch for this whole side of the body there, and it'll hit you where you're tightest. Okay, great. So we've covered the shoulder area, the upper arms. Now we're into the forearms. Again, there are some standard stretches for this, but typically for most dancers, I don't advise them, particularly if you're hypermobile. We'll just show you them so that you're familiar with them and you can decide whether or not they're appropriate for you. Some people, they just don't work, you don't feel them, but for other people, it's putting a lot of force through the wrist joint, which is not good, particularly if you've got unstable wrists if you're a hypermobile person. So on the forearm, when we talk about forearm muscles, we always start from this position with the palms up. This is known as the anatomical neutral position, because we've got some muscles on the front of the forearm, and their job is to pull our wrist and fingers upwards. And then we've got another set of muscles on the back of the forearm that take the wrist the opposite way into what we call extension. So we need to address both sets of muscles, the ones that flex the wrist and the ones that extend the wrist. The standard stretch for those you've probably seen, if you want to go side view for this one, and take the arm out in front of you and then pull those fingers back. Now, number one, are you feeling a stretch? No. You can see he's a little hyperextended in the elbow and that wrist is in quite an extreme position. That's not going to be, it's not even stretching, and it's not a good one for his wrist, so relax out of that one. Similarly, palm down, if we pull the wrist forwards, again, I don't like that angle, right? Too much stress going through the wrist and really not anything going on at the forearm. We're much better off with these muscles, very similar to the lower leg muscles, if you've watched that video. Again, muscles that are difficult to stretch, we're much better to use an active release technique. These are the stretches where we use our own hand pressure to localize and focus the stretch, and then we actively take that muscle through its range, and it creates that contracting and stretching motion that's really going to target these smaller muscles in a much more efficient way. Now, the best way to do this is kind of sitting at a table. We're going to improvise a little bit with our treatment table here, and what you want to do is have your arm on a surface. You want the forearm resting on a surface, but you want the wrist off the end of it because we need space to move that wrist up and down. Now, the muscles here, if we've got the palm facing down, these are the muscles that bring the wrist up. So you can see those muscles firing up as he brings the hand up. So what we're going to do is if we bring that wrist up, you're going to use your other hand to come around and put some pressure. You're going to squeeze down and trap the muscle under your hands and then push up a little bit towards the elbow this way. Then from that position, you're going to slowly bend the wrist downwards. Feeling a stretch there? Yeah, great. Then, you want to start about a third of the way up the forearm. Then once you've done that, you can move up to the next spot and then take that wrist down. Lovely. Try and relax your shoulders as you do it. Get the force coming from underneath. And then you could probably go one step higher. Yep. And press. And then the wrist goes down. So that's really going to focus the stretch in the particular areas. And again, you might find one spot that's particularly sweet and you want to do a couple of repetitions there. So that was for the muscles on the back of the forearm. Now if we go palm up and look at the flexor muscles on this side, we're going to do the same idea here. So bring the wrist up to start so the muscles are slack. Press down and push up towards the elbow and then extend the wrist downwards. And again, you can work your way up the forearm that way. So that's a nice little active release for those forearm muscles that are notoriously hard to get any other way. Lovely. Okay, if we come back around the front, we can also just do a little massage type work. You can perch yourself down for this one. What I like to do for the forearms, I work with my hands all the time, so it's a good way to release them, is literally just kind of grip around that muscle and pick it up and roll it on the bone. Just do a little bit like you're kneading bread or pizza dough or something, and just pick up and roll those muscles. You can pick your fingers across the other way as well. You'll feel they're a bit like kind of guitar strings under there, and you're going crosswise around them. And that can be a good way just to release that tension, particularly if you've done a lot of like weight-bearing work on the arms. Feel nice? Mm-hmm. Yeah. And that's good for getting the blood flow in. Also good before you do any exercise, before you do your weight-bearing work, because you're just getting the blood in, warming those muscles up so they're ready to fire. Remember, we don't stretch before exercise, but we can get our hands in and soften them up that way, so much more efficient. So, hope you can have fun going away and playing with those stretches.